To my colleagues, Chris Maloney and Flory Nkoy. They have been pioneers in really working with the complex medical problems of children with asthma. And they have used all of the technology and all of the approaches to improve these children's lives and the lives of their families.
We did a study identifying about 9 evidence-based treatment modalities that should be used in the care of children hospitalized with asthma. And we found we were not very compliant with most of those. And so we worked on getting some monies to streamline our process, to standardize the care of patients. And in the process of doing that, we developed a paper-based tool which tracked a patient's asthma symptoms using the asthma symptom tracker, which was a piece of paper that they got a score by answering a few questions, and then they mailed that score in on a 3x5 little postcard, and then they plotted it on an 11x17 sheet of paper on their refrigerator. And what we found is that parents of patients with asthma who were highly compliant with that tool, that paper tool, did better with their asthma control. They didn't go to the emergency department as often. They didn't get admitted to the hospital. But we knew that the paper tool was probably not something we could distribute in a large area, and therefore we wrote another grant to computerize that tool, to develop one that can be used as a web-based application. And again, we enrolled many patients and their parents in the use of this tool, and found the same thing, that with high compliance, utilization of resources both outside the hospital and then their readmission rate went down. We've subsequently developed a mobile application of that web form, and then a company that we're working with is building a true mobile application. They actually have it and are marketing it outside of the university with the license that we hold within the University of Utah.
On the primary care providers, the best thing is they understand the asthma, the asthma better, and also the effectiveness of asthma treatment. And they also have they know better when it's appropriate to increase the treatment or decrease the treatment. And also, if what the asthma tracker also give them the information when they need to add like a controller therapy, which is good to control asthma over time, to control the inflammation, and then reduce the risk of an asthma exacerbation.
The non-financial return on investment of this tool is not missing school for the children, not missing work for the parents, not having to leave work early for the parents or get out of school. And those are very important factors that need to be considered outside of just financial returns, because this chronic condition is very disruptive on families, but managing it can mean harmony for the families with a child with asthma. One of the keys for success of any project is alignment. Alignment with physicians, alignment with physician investigators, and alignment with hospital administration. And that's what we found to be our advantage working at Primary Children's and the University of Utah. We are extremely aligned. When we set out to develop our strategies to improve the care of children with asthma, we were initially funded through the Primary Children's Foundation. We were resourced in kind from Primary Children's Hospital to develop a lot of the data reports that we needed in order to use their data systems. And it was that kind of collaboration and alignment that allows for success, and then allows for us as a research team to go out and turn what they gave us, which was about $400,000, and currently we're pushing $7 million in return on that investment. And so that's real numbers, but most importantly, we're helping children and their families with this chronic condition called asthma.